Technical section. A healing environment is a sustainable one. Fortunately, people are becoming more aware of the benefits of sustainability, though there are still misconceptions. Sustainability often comes with many co-benefits beyond doing good for the planet. These benefits are important to understand and to capitalize on, especially when trying to convince various stakeholders to take this virtuous route. Health benefits of sustainability. Sustainability initiatives have long-term and widespread benefits, such as reduced emissions, that help with general population health, i.e., reducing GHG emissions reduces your contributions to global climate change. Depending on the location of your hospital, sustainability initiatives can provide tangible benefits to your patients and their communities, including reduced air pollution from switching to renewable energy sources or minimizing solid waste transportation and treatment, reduce chemical exposure from things like pesticides or herbicides, and increasing access to well-paying jobs by prioritizing local supply chains. Green design can also produce tangible benefits for staff and patients. Green space and views of greenery, even just pictures, has been found to reduce stress, improve circadian rhythms, and shorten patient lengths of stay. Prioritizing green building design can reduce chemical exposures for staff and patients while improving working and care conditions. Business benefits of sustainability initiatives. Across many industries, sustainability initiatives have been found to reduce costs and improve recruitment, retention, and customer loyalty. We are finding the same is true within healthcare. Efficient operational performance. Sustainability initiatives are often focused on efficiency and optimization. For building design, this means using design criteria to reduce energy demand, including passive building design, appropriate insulation, geothermal, and energy-efficient appliances. For building operations or commissioning, it means a holistic assessment of building needs and making sure all building control systems like air conditioning and heating are operating in harmony with each other. For supplies and equipment, this means sourcing only what you need and reducing unnecessary waste. For waste treatment, it means proper location and sizing of bins and appropriate sorting of waste. All of these things reduce the amount of resources, energy, and supplies needed to provide care, ultimately saving the health system money from purchasing, using, and disposing of these things. Gunderson Health System, based in Wisconsin, was the first to achieve energy independence, sourcing energy locally. We reduced our energy consumption per square foot by 25%, says Rich, one of the energy engineers on the project. The technical topics section highlights many of these various initiatives and also shows you how to quantify the amount of money saved from implementing these at your health system. Increased recruitment and retention. This relationship is less clear in healthcare compared to other industries, but sustainability initiatives typically make it easier for businesses and health systems to recruit excellent talent, and once recruited, help businesses and health systems hang on to those people longer. This is better financially, as less money is spent attracting and training new talent. It is also better for the health system's performance, typically resulting in better outcomes for patients, as staff's values better align with the systems, and they better understand other staff members and the working culture. Addressing risks and increasing resilience. Risk assessments, even climate risk assessments, are a separate topic from sustainability, but there is some overlap. Many sustainability initiatives also help hospitals minimize risk and increase resilience. For example, improve operational efficiency, understanding your resource needs and using fewer resources, means that if there's a shortage of your supplies or a sudden price increase in your energy, your health system already understands what it needs and has removed waste from those systems. Gunderson Health System has found that by sourcing energy from a variety of local sources, they are no longer at risk for changes to oil and gas pricing. During the COVID-19 pandemic, many hospitals experienced terrifying and crippling shortages of necessary medical supplies, like single-use disposable personal protective equipment. Health systems that already owned reusable PPE were better able to care for patients while keeping staff safe. Likewise, health systems procuring reprocessed single-use devices from third-party reprocessors also had access to critical supplies when international single-use supply chains fell short. However, the overall impact of the pandemic on plastic use was a negative one, with an increase in single-use plastics and plastic pollution that will likely be felt for years to come. The COVID-19 pandemic emphasizes our increasing reliance on single-use plastics and how future measures should reflect a balance between public health and environmental safety. Social benefits of sustainability. In addition to the health benefits described here, sustainability initiatives can shorten supply chains and make them more local, under the purview of local laws and regulations, which are less likely to be curtailed. This has been demonstrated in the agricultural industry. For example, community-supported agriculture, or CSA initiatives, are growing in popularity in the U.S. and abroad. CSA activities address the social, environmental, and economic dimensions of sustainability by promoting a healthy diet, sustainable agriculture, and social justice to producers and consumers. Producers have their sales guaranteed, receive higher incomes, and their work conditions do not harm their health. Consumers are educated on sustainability through face-to-face contact. This is an example of a successful incorporation of sustainability into a business strategy on multiple levels, with clear benefits for both the producer and consumer. Sustainability has found its way into healthcare settings as well. In one example, a recycling program was implemented for PVC waste in a urology unit. Implementation of recycling was found to have saved over 2,400 liters of water, reduced carbon dioxide emissions by 930 kilograms, and saved 3,700 kilowatt hours of energy. Projected 5-year recycling estimates suggest potential financial savings could reach 25,000 euros or close to $30,000. This program not only saved money for the institution, but it is also reducing GHGs for its community and decreasing environmental exposures to PVCs. This is an example of how sustainability measures can reduce the inequitable burdens of healthcare waste management by benefiting not only the hospital, but the community around it. Sustainable projects and programming creates jobs for the local community. One example is Cleveland Clinic, who sources 30% of their food locally and sustainably, helping to shape a thriving food system with long-term benefits to the communities they serve, while keeping local farmers and food procurers in business. In 2019, the University of Vermont Medical Center opened a new inpatient building where 100% of construction and demolition debris was recycled and helped create new construction jobs, cutting their carbon and waste footprint and helping the economy simultaneously.